Sewa Rural. Let life be an offering. God resides in all of us, particularly in the poor. The service of this Daridra Narayan is true worship, a real offering. Some friends with education and experience in India and abroad were motivated by the inspiring ideals of Swami Vivekananda, Gandhiji, and Sri Ramakrishna. Over a period of time, like-minded youngsters joined them. The mission was reaching out to the poor, value-based work, and self-development of employees. The aim was, besides health, socio-economic development of people. A lamp was lighted with the resolution, let life be an offering. Name, Sewa Rural. Location, rural tribal area of Bharuch district in Jhagadia. With a hope that nearby industries would support economic development and faith that the adjoining Narmada would provide peace. The local community contributed a small hospital, which is now a 250-bed modern hospital providing expert services of gynecologists, pediatricians, ophthalmologists, surgeons, anesthetists, and physicians. These medical services are supported by a modern laboratory, blood storage center, X-ray, sonography, operation theatre, and a neonatal intensive care unit. Suggestions are welcomed from the representatives of the local community who are included in a medical committee that is set up for hospital management. In the last 4.5 decades, more than 27 lakh patients from over 2,500 interior villages have benefited from the hospital services, of which 70% of patients have been treated for free. Sewa Rural's first referral unit was proven to be a blessing for high-risk pregnancies and infants. As a result, there is a steady increase in the average daily count of outpatient and inpatient consultations, deliveries, operations, and patients who are treated for communicable and non-communicable diseases. A mega construction project is underway to expand the hospital that includes 3 new multi-story buildings to accommodate the growing number of patients, an additional 150 patient beds, a new eye care center, operation theatres, a 50-bed newborn ICU, a state-of-the-art autoclave, as well as a canteen and parking facilities will be blessings to the patients. To improve access to medical care for the ultra-poor communities in the most remote places, a satellite center has been started in Dediyapada, about 70 kilometers from Jhagadia. Because the satellite center has sonography and laboratory facilities, only a few patients now need to travel all the way to Jhagadia. The comprehensive eye care program that began in 1988 provides comprehensive treatment and operations for the majority of eye diseases. Every week, eye-related diagnostic camps are organized in various villages, far and wide. Patients in need of eye surgeries are brought to Jhagadia and dropped back at their home satisfactorily after the surgery has been performed. Additionally, 822 blind individuals from 7 underserved talukas of Bharuch and Narmada districts have been rehabilitated through educational and vocational training under the community-based Blind Rehabilitation Program. Several steps were taken for awareness and disease prevention for the poor who may not be able to reach the hospital. To provide medical care at the doorstep of citizens, a mobile dispensary was started in 1982. Subsequently, Sewa Rural successfully delivered comprehensive health services to 40 villages by running a primary health center entrusted by the government for 15 years. After that came the decade of the Safe Motherhood and Newborn Survival Project, serving the entire Jhagadia Taluka, encompassing its 168 villages. As a result, maternal mortality and newborn mortality reduced by 75% and 38% respectively. A special project is now underway to diagnose, provide intensive treatment, and conduct field-level follow-ups for sickle cell disease, which is prevalent among the tribal population in the area. In addition, infants discharged from newborn ICU are followed up for 5 years. This has led to a marked reduction in malnutrition and child mortality. Our years of field experience were helpful in the creation of IM-Techo mobile phone application. This mobile phone application has inbuilt videos for health education, work-related reminders, tools for identification of high-risk patients and features to supervise the work of health workers. This application has boosted the efficiency and effectiveness of health workers in the government. Following successful research, a large-scale implementation of this technology provides public health benefits to over 30 crore citizens of Gujarat, Uttar Pradesh and some union territories of India. Sewa Rural makes an important contribution in this effort. The Adolescent Empowerment and Awareness Program is instrumental in reducing the evils of addiction, anemia and unhygienic menstrual practices among 5,000 adolescent boys and girls every year. In addition, sanitary corners for menstruating girls are established in 249 schools in Gujarat as part of an innovative project. A special project has commenced to provide diagnosis and ongoing treatment at the village level for non-communicable diseases like hypertension, diabetes, and mental health conditions. We have undertaken scientific research on our hospital-based as well as home-based healthcare delivery projects. The essence of our experiences is being published in the form of research papers in acclaimed national and international peer-reviewed journals. On the other hand, our Health Training Center is providing training to health workers working in various non-governmental and governmental organizations, intern doctors, as well as university students from India and abroad. Over 130 organizations and over 26,000 trainees from India and overseas have benefited from our training programs. Sometimes our own doctors and employees have embarked on journeys to serve the underprivileged in even more remote areas. Our joy is doubled to see the growth of their work. Other non-governmental organizations such as Jashoda Narottam Public Charitable Trust also benefit from Sewa Rural's experience and technical knowledge. In 1987, a technical training center was established in Gumandev to provide vocational training to youth who are unable to pursue higher education for various reasons. Workshops equipped with the latest machinery, a hostel, playground and library are some of the facilities available for the students. The young students receive year-long practical residential training in various trades such as turner, fitter, welder, electrician, environmental plant operation, solar, safety, printing and so on. Also, women receive training in courses pertaining to nursing, lab assistantship, sewing and beautician skills. Various character-building educational activities include prayer, Shram Yagya, celebration of festivals and camps to develop soft skills and lead value-based work among students. As a result, industries are keen to recruit our students. Sewa Rural also provides guidance and support to those students who wish to become entrepreneurs and start their own business. It is heartening to see more and more young girls and boys successfully complete their training and contribute to improving the living standard of their poor families. External evaluations have highlighted that the majority of project parameters have been realized. Programs to promote socio-economic growth of women from underserved communities were initiated in 1986. A new sister organization, Sharada Mahila Vikas Society, was established in 2002 with the goal to empower women to lead and manage these programs themselves. So far, it has contributed towards empowering more than 1,500 underprivileged women who now support the growth of their families. We have also been able to provide supplemental education to over 1,300 school children for their well-rounded development and make them responsible future citizens. Sometimes, Sewa Rural has discontinued programs upon not getting expected outcomes. Such programs include handicrafts, cottage industries, social forestry and papad making. On the other hand, we have implemented projects for harnessing energy from rooftop solar, purification of polluted water, harvesting rainwater, and recharging groundwater. All employees work together in synergy and join hands for various celebrations. They also participate in discussions and analysis of events during regularly held meetings. Special emphasis is laid on collective decision-making as well as collective responsibility. Transparency, accountability, and readiness to face challenges are sincerely ensured in every effort. Therefore, all the activities of the organization, its responsibilities, and desirable or avoidable outcomes are all accepted collectively. Additionally, transportation service for school-going children of the staff members, educational support, and cooperative society provide important support. Staff members are also provided with residential quarters and support to purchase their own housing. Our community kitchen has been a blessing for staff as well as patients. Sewa Rural is fortunate to have young professionals who have been conscientious about serving the poor and being sensitive to the organization's ethos. More and more employees see Sewa Rural as their own, and some have even earned a place to serve as trustees of the organization. The tradition of entrusting organizational leadership to a loyal and dedicated younger generation continues to sustain the noble work of serving the underprivileged for years to come. Not surprisingly, the organization has been honored with the title of Great Place to Work year on year. Over time, our approach has become purer and more resilient from the challenges and difficulties we have faced. From time to time, Sewa Rural has welcomed saints and social workers from various organizations who continue to provide inspiration and strength to the organization. As a result, our faith in God and trust in the goodness of ordinary individuals have grown. Employees join hands in receiving over 35 national and international awards that the organization has been honored with over the years. One of the founding trustees, Dr. Lataben Desai, was awarded Padma Shri Award by the Government of India in 2022, which is a matter of pride for all of us. The expenses towards our activities are supported by the grants we receive from the government and other funding agencies, as well as donations from industries. That said, the donation and support we receive from well-wishers like yourself is vital for our work. We draw strength from our community prayer every evening. which includes reading an inspiring passage, singing a bhajan or two, and engaging in brief silence for soul searching. We have trust that God gives us strength to fulfill our dream of being helpful to the rural community through such prayerful approach. This is an earnest team effort, a yajna, to wipe tears of suffering, deprived fellow beings. We have trust in our value-based efforts and immense faith in God that this unselfish social work will help us reach perfection. And if amongst us, each one may not attain to that perfection, still we may get it collectively by counteracting, equiposing, adjusting and fulfilling one another. This would be harmony by number of persons. Swami Vivekananda.